Hi, I'm Dr. Lawrence Broder, MD, Medical Director and owner of Beleza Medical Spa with offices in Round Rock and Austin. The purpose of this video is to do a examination of the Smartlipo procedure. We're going to take you from all the steps from the beginning to the middle to the end. Basically what this procedure is liposuction done in office under local anesthesia. We're also going to use the Smartlipo Laser to help us smooth the fat and tighten the skin. We're going to show you from the beginning, from taking pictures to her anesthesia, to the aspiration of the fat, to the laser procedure. Patient will be awake during the procedure. She'll have some light sedation, but you'll see, due to the anesthesia, that she will not be feeling anything. The great thing is she will not have the risk of general anesthesia nor the recovery. In fact, at the end of the procedure, she'll get dressed up and go home numb. So let's begin the procedure. Can I have you lift your arms up? There you go. Let me just do a picture from the front and from 45 degrees, right there. Good. And from the side, here. So, just going to look here. Kind of separate the abdomen into some couple of segments. This is the lower abdomen. And these markings actually are topographical, so they tell us where the most fat is. So that's what we can go after. And I'm going to look up here at your rib cage. That'll be our upper limit of our procedure. And then look here at your, and then we have some upper abdomen fat. We're going to mark that, where the most fat is. And then we're going to look over here at your love handles. Going to have you turn over a little. And we see where fat is on the love handle. We're going to come up here. Okay. I'm going to look at the other love handle. Okay, we're going to start the preparation for the Tumescent Anesthesia. So the Tumescent Anesthesia is the most important part of this procedure. That's where we add the saline solution that contains the lidocaine and epinephrine. That makes this whole procedure possible. So what we're doing first is a skin prep with some betadine. That's just to prepare the skin for there's no bacteria. So we'll just do a thorough prep here. You're going to feel a little stick here. And we've just done a little area of local anesthetic. And then we're going to use a little punch to make a little hole, a little incision. You doing okay?
Doing fine.
Good. So there already we made a little incision. So the next step is we're going to use a catheter to instill the local anesthetic. And it's the only part that's a little uncomfortable, but we are putting anesthetic in. So it goes numb very quickly. Okay? You can see it's just fluid that comes out of this catheter. It's harmless saline with some lidocaine. And what we're doing is we're putting this into the fat layer between the skin and the muscle. This is what area we work in that fat layer. So we're filling it up. So it's doing a couple of things. You can see it's expanding. So it's lifting the fat up off the muscle. It's giving us space to work. And it's filling it with lidocaine. The lidocaine's blocking her nerves so she won't have any pain. And the epinephrine in that solution also constricts the blood vessels so there's no bleeding. 2.5 liters of fluid so far. You can see how her abdomen is now swollen with the fluid. You can even see it's blanched. And what that means is it's, kind of whitish. And that's because the epinephrine is working, constricting the blood vessels, so there won't be any bleeding. And you can see we just made a few small incisions, very tiny, and one by her abdomen, one by her belly button. She's done very well. She's been a great patient. And almost finished here. You can also even see the orange peel appearance, which indicates we have really good tumescence. So what we're going to start now is the period where she's just going to hang out. She can do whatever she wants. And we're going to let this tumescent fluid just percolate in here, and by the time we start, she will be completely numb. Okay, we're going to start the procedure. She's now tumesced. She's been waiting for about a half hour. She appears, her skin condition looks good. She's well blanched. We've prepped her thoroughly. Do you have any sensation there? Feel numb?
Feel numb.
She feels numb. You will feel some movement during this procedure, but the pain fibers are blocked, okay? Now, if we get to an area where you feel that there is pain, let us know. We have a reserve of anesthetic fluid. So the first thing we do is called tunneling. We use a special cannula that makes tunnels in the fat. And we do this because we want to make room for our work. So we're just going to work in different areas and cannulate with this. It's called a rasper. And it actually will liquefy some of the fat and make tunnels. You can see it moves in very easy because we have that fluid in there. Aspirate some fat. Use a different cannula for that. This cannula only has little holes on the bottom, so it actually at the top protects the undersurface of the skin. We just want to take the fat underneath. So we're going to start some lipo here. Main goal in the beginning here is just to make this fat layer smaller. Kind of globules of fat with that tumescent solution we put in. So it's basically a blind procedure. We're working through small little holes, and you can see nice fat, no blood coming out. But the way I tell it is what's going on is my hand, I'm working underneath my other hand, and I can feel the layer of fat getting smaller. And then I also look at the tubing to see what we're getting out. So it's a lot of it is just by feel and by looking at what's the return is. So I can feel her fat layer getting small. And how are you feeling? Any pain?
No pain.
Can you feel some movement? Okay. You can see she's very comfortable. Left lower quadrant of her abdomen right now. What we try to do is work each quadrant. So we know how much fat we get out of each quadrant. Want to try to get symmetry, so try to keep track of that. So we get even amounts of fat out. Now if you look, we've already done some of this lower quadrant. If you look in the jar, we have about 400 cc's of fat out from there. And you can already see a visible difference from the right to the left. So now we're going to start some aspiration of her right side. Same thing. You can see the fat coming out. Nice chunks of fat. No big amounts of bleeding. That's what we want to see. We just want to see flat fat and tumescent fluid returning. So basically we just go through each quadrant and we decrease the layer of fat a few millimeters at a time. What we're really trying to do here is not just take out a large amount of fat. This is a sculpting procedure. We want to leave a smooth, uniform fat layer. So it's all about being even. It's not about the amount of fat we take, it's the amount of fat we leave, because when she goes home, she's going to be looking at the fat I left on her body, not the fat I took. So that's the most important part. Patients come in, they a lot want to know how much fat, they want the most amount of fat taken, but the true concept is to leave the right amount of fat and leave it in the right condition so that she looks good and has the results she wants. So we've been aspirating. We've already removed one full container. You can see mostly fat. This is some of the fluid at the bottom. It's a little blood tinged, but all normal. But a good amount of fat there. We've almost filled up another container. She's been pretty comfortable. She's had a few pokes here and there, but otherwise pretty comfortable. And you can see her results already. You can see from where we started, her abdomen is almost flat. We can see her rib cage, and her waist is starting to get tighter. Probably going to take off a little more fat. But at this time, we're going to go to start doing some of the Smartlipo laser. This is the laser cannula and fiber. The fiber comes out through the end here. We go through the same incisions. And basically what we're trying to do here is two things. Depending on the level, and you can see the light here under the skin, that helps me see where the laser is. We're doing two things. One, the laser hits the fat cells and causes the fat cells to melt and liquefy. It helps us get more fat out. It helps us make that smooth layer of fat, that fat layer nice and smooth. Remember before I said that's the whole key to this, is for us to leave a smaller, smoother fat layer. The other thing we do is we're heating up right under her skin. And the reason we do that is when you heat up under the skin, it causes skin contraction and new collagen formation. So not only do we want to get a nice smooth fat layer, but we want her skin to retract so it fits nicely over her muscles and the remaining fat layer and give her a nice result. So basically, just like the aspiration, we just heat with the laser in these quadrants. And basically what we'll see is you'll actually get a return of a greasy fluid. That's the melted fat. But it's an important part of the procedure because we want that fat layer, like I said, smooth, and we want to get that skin retraction. And some people do the laser first. We will do that sometimes first before the aspiration. It's a very thin patient because we will get some fat melting with it. But in my opinion, the laser should be done after the aspiration because we want the laser to be kind of our fine-tuning of the procedure. It's going to smooth out that fat layer, and we want the heat to also be used for skin tightening. See, she's much flatter. She had a good amount of fat here on her lower abdomen. You can see it's almost flat at this point. You have to remember she does have tumescent fluid still in here, so this will drain over the next couple of days from these incisions. We want her to drain because the drainage helps her actually recover quicker, and there's melted fat in there that we don't want her to absorb. In fact, if I touch it, it's greasy. So by letting her drain, she gets better faster and she doesn't absorb any melted fat. Those incisions will seal on their own in 48 hours and the drainage will stop. We don't have to suture them or anything, they heal fine. And we're going to put her in a compression garment. It's a tight undergarment. She's going to wear that for about 3 to 4 weeks after the procedure. She's numb right now. She'll get dressed, go home. She'll get sore later on, so she will have some pain medicine. And then in about a week, she'll have a massage because she will get a different type of swelling after the procedure. That usually goes away in 3 to 4 weeks too. You can see the amount of fat in the containers. That's what we got from her. And the bottom part is tumescent fluid. So we got a good about 2 liters of fat off her abdomen. Just the right amount of fat. You can see her rib cage is showing. She's flat. She's got more of a waist. And then we'll see how this all heals up. And for the experience, was it bad? Or?
No, it was what I thought it was going to be. It's terrible.
Yeah, and for the most part, she was numb. She had a couple of points where we got towards the edge where she got a couple little surprises, but she has no recovery now, and she's just going to go home.